Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the heparin. The heparin is an anticoagulant. So this is an anticoagulant. Okay, and it prevents the action of the blood coagulation factors. It prevents or interferes the actions of the blood coagulation factors. Okay, we got the heparin. Heparin structurally is an anionic. This is an anionic glycosaminoglycan. Okay, it is acidic because it contains carboxyl acid. It is acidic, contain carboxylic acid and sulfate. Okay, sulfate. So we got the structure of heparin. Heparin is present in our body. Heparin is present in our body in the mast cell along with heparin in the vesicles of the mast cell. The exact role of heparin of the mast cell, the connective tissue cell, is not exactly known. We don't know exactly. Okay, so we got the heparin anticoagulant, and it prevents or interferes the action of the blood coagulation factors. So if we go to the pharmacokinetics, okay, so it is not absorbed through the intestine, so it can be only used parenterally. Okay, applied by injection. That may be subcutaneous and maybe intravenous or subcutaneous. Intravenous or subcutaneous. We have two types of heparin we use. One is the regular heparin, what we'll discuss here as unfractionated heparin. Okay, heparin that is unfractionated. This is unfractionated heparin, and this is the low molecular weight heparin. Another one is the low molecular weight heparin. Okay, so this heparin, it can be used by subcutaneously or by intravenously. Usually we put deep subcutaneous. Low molecular weight heparin is used subcutaneously. Okay, so if heparin can be used in subcutaneous or intravenous, both are possible. Okay, and we don't apply heparin by intramuscular injection because it will cause hematoma. Okay, so once heparin is in our system, it works very quickly, especially the regular heparin. It start working very soon, within minutes. Okay, and half-life of regular heparin is around 2 hours. In case of low molecular weight heparin, it is about 4 hours. So the heparin will be attached to other proteins, and it is taken out by the mononuclear phagocytic system, and it goes to the liver. So it is in the liver, it is metabolized, okay, depolymerized, and it is made simple excretory products. So if a person has liver malfunction like that of cirrhosis of liver, in that condition half-life will be increased. Also, it is excreted through the urine. So if the person has renal failure or renal disease, then the medication will be in the system for a long time. It will be high half-life. Okay, we got the pharmacokinetics of the heparin. Now we'll go to the therapeutic application or indications. Therapeutic indications. Okay. Heparin is used to prevent deep vein thrombosis and pulmonary embolism. So, deep vein thrombosis, pulmonary embolism, acute myocardial infarction, okay. It is used as prophylaxis in case of hip replacement surgery. Prophylaxis in hip replacement surgery. Surgery. It is used by the pregnant women if they have some type of prosthetic heart valve, or if they have pulmonary embolism, okay, during pregnancy. If it is indicated, if they have prosthetic heart valve or they have pulmonary embolism during pregnancy, okay, it can be used because it does not cross the placenta, so it will not harm the baby, the fetus, and it will not cause the congenital birth defect, okay, to prevent embolism and also it is used if the female pregnant women having prosthetic heart valve, valves. Okay, we got that. So it has multiple use. Okay, so it is also used to pass a catheter as a prophylaxis. So in case of to prevent clotting to the catheter, when catheter is passed through the blood vessel, catheter, okay, in cardiac bypass surgery or on hemodialysis, okay. So we have multiple use. So deep vein thrombosis, pulmonary embolism, acute myocardial infarction, prophylaxis in hip replacement surgery during pregnancy to prevent embolism or having prosthetic heart valve, okay, to prevent clotting to the catheter, especially in case of bypass surgery, and also in case of other prosthetic application of something in the body, so we to prevent blood clotting. Okay, also it is in case of hemodialysis, so we got the therapeutic indications. So how it work? What is the mode of action? Mode of action. So if we go to this figure, this is unfractionated heparin. This is heparin. Okay, heparin, it has pentasaccharide sequences there that connect with that of the antithrombin. This is antithrombin. Okay, antithrombin is a glycoprotein. Okay, so that is produced in the liver. That antithrombin work with that of the, it work against it, it will be attached to that of the factor 10A. Okay, blood clotting factor 10A. Also it will attach to that of the thrombin. This is thrombin. Okay, thrombin. So in presence of heparin, the attachment of the antithrombin to the factor 10A, and also antithrombin with that of the thrombin will be accelerated in presence of heparin. So this is heparin, this is antithrombin, and this is the factor 10A. Factor 10A is inactivated by the antithrombin. This is the thrombin, it is inactivated by the antithrombin. This is the heparin, this is the heparin. So this is the mode of action. We know that 10A is very essential for the formation of thrombin from prothrombin. Okay, and thrombin is essential to form the fibrinogen into the fibrin. So if we inactivate these two, then there will be no blood clotting or less blood clotting. So thrombin is coming from the prothrombin, that is the factor 2, prothrombin to thrombin, that is activated by 10A. 10A is a common pathway for both extrinsic and intrinsic pathway of blood clotting. Okay, so that thrombin is usually working on the fibrinogen to produce fibrin network that will entangle the platelets and other blood vessels. So if we can inactivate the thrombin and 10A, because 10A is essential for conversion of prothrombin to thrombin. So this is the common pathway, both extrinsic and intrinsic way of blood clotting. So if we can inactivate this and this, then there will be no blood clotting. Okay, this is one way. This is the low molecular weight heparin. How it works? This is again antithrombin. This is antithrombin or antithrombin. Okay, this is the factor 10A. So factor 10A will be attached to the antithrombin like this very quickly due to the presence of heparin. Without heparin, they do not come in close contact, may come in close contact very slowly. So heparin accelerates the attachment of the 10A to the antithrombin. Here, the low molecular weight heparin does not work with the thrombin. Okay, it only works on the factor 10A. Okay, we got the mode of action of the heparin. Now we'll go to the adverse effects of heparin. Adverse effect. Adverse effects are, as because it's an anticoagulant, there will be bleeding or hemorrhage. Okay, hemorrhage. There will be thrombocytopenia. recurrent thrombosis that is possible due to excessive thrombocytopenia. Okay, so due to thrombocytopenia there may be paradoxical thrombosis that may happen. Okay, we got that. Then hypersensitivity reaction. Hypersensitivity reaction. Why this happened? Because heparin is derived from the intestine of the pig, porcine. Okay, so it is also derived from the lungs of the cow, bovine source. So porcine and bovine source, these are the animal source. They have different type of protein, so there is chance of hypersensitivity reaction. We may have osteoporosis. Osteoporosis is another prolonged use may lead to osteoporosis, and it will elevate the liver enzyme. That is another adverse effect. Elevates the liver enzymes. Okay, we got the adverse effects of the heparin. Okay, so hemorrhage, thrombocytopenia, there may be recurrent thrombosis. We call it paradoxical thrombosis. Better to say paradoxical thrombosis, hypersensitivity reaction, osteoporosis, and elevation of liver enzymes. These are the adverse effect of heparin. Okay. Now we'll go to the contraindication of the heparin use. What are the contraindications? Contraindication. Okay, in case of active bleeding, it is contraindicated. Bleeding, any type of bleeding, active bleeding. Okay, hypersensitivity. In case of surgery inside the we can call it intracranial surgery, intracranial or spinal surgery. Okay, so it should be surgery. In case of visceral cancer, in case of active tuberculosis, okay, so in case of active tuberculosis, and in case of endocarditis, hepatitis and renal failure, okay, we have take precaution. Okay, so we have many, even in case of abortion, that is threatened abortion, okay, so we got the indications, contraindications like bleeding, active bleeding, hypersensitivity reaction, intracranial or spinal surgery, visceral cancer, tuberculosis, endocarditis, hepatitis, renal failure, and threatened abortion. These are the possible contraindications. So again, we go to we have to go through two types of heparin. One is the regular heparin, that is unfractionated heparin. It has the low. So how can I differentiate between heparin and low molecular weight heparin? low molecular weight, that means molecular weight around 7,000 or less. Okay, here half-life is around 2 hours. Half-life will be more than 2 hours. 2 hours here. This here about 4 hours. Okay, it's very important. Bleeding, more bleeding, less bleeding. Okay, we got that. Then less bioavailability, around 20%. Less bioavailability, around 20%. Here more bioavailability, around 90% bioavailability. Okay, then you have to know that other problem, this is used in hospital setting. This can be used at home, and it is used by subcutaneously. This all it is used both subcutaneous and intravenous, usually deep subcutaneous and intravenous. And also our regular heparin, its action is unpredictable. This action is predictable. This is okay. So we got the differences between the low molecular weight heparin and regular heparin. So we got that half-life, more bleeding tendency, less bioavailability, hospital setting under doctor's supervision, nurse supervision, subcutaneous or intravenous, both possible, unpredictable. The other is here. Okay, the differences between low molecular weight and the normal regular heparin. So what is the antidote for heparin? Antidote for heparin. Okay, this is the protamine sulfate. Okay, sulfate. Okay, protamine sulfate is derived from the sperm, from the fresh sperm. Okay, so this is also an anticoagulant, so its use should be regulated and should be monitored. Okay, and also another point, in case of heparin, we give the bolus dose, then we maintain sustainedly. So we must titrate the dose for heparin. It is very essential to titrate it. Heparin is titrated. Dose should be titrated by assessing the activated PTT, partial thromboplastine time, that should be around 1.5 to 2.5 normal value. Okay, so this is the way. So we got the heparin and the low molecular weight heparin, and that's all about the pharmacology of heparin. If you like my video, please support my channel. Please share the information with your friends, and any question, please feel free to ask me, and please subscribe me. Have a nice day. Bye now.